Welcome to the Gastro Girl podcast. We bring together patients, experts, and health advocates who are all here to help you optimize your health. Here's your host, Jacqueline Gollin.
Hey everyone, welcome to the Gastro Girl podcast. I'm your host, Jacqueline Gollin, and today we're tackling one of the most frustrating and common digestive health challenges yet again, chronic constipation. This episode is brought to you in part by Vibrant Gastro. If you've been struggling with chronic idiopathic constipation, which really means there's really no cause of this, it's consistent, it's chronic, you know that traditional laxatives don't always work consistently. And for many patients, they're not an ideal long-term solution. But what if there was a drug-free alternative designed to work with your body's natural rhythm? That's exactly what we're discussing today with Dr. Darren Brenner, a renowned expert in neurogastroenterology and motility disorders. Dr. Brenner is a professor of medicine at Northwestern University Feinberg School of Medicine, where he specializes in diagnosing and treating complex GI conditions. Dr. Brenner has joined us on the podcast before, and we're thrilled to have him back to address your pressing questions about Vibrant, the innovative vibrating capsule designed to stimulate natural gut motility. So if you've been curious about this vibrating capsule and how it fits into the treatment landscape for chronic constipation, this episode is for you. Thank you so much for joining us again, Dr. Brenner. You're one of our favorites guests on the show. Our listeners love you. You really break down hard, confusing, and embarrassing topics in a way that's so easy to understand, and it makes you go, and you want to learn more. So thanks for joining us again.
My pleasure. Thanks for having me.
Great. So for those listeners who are just maybe jumping into this episode without hearing our previous episodes on chronic constipation or chronic idiopathic constipation, can you please define that briefly and tell us how it differs from the occasional constipation, which we're all maybe familiar with from time to time?
Sure. I think the name speaks for itself, right? Occasional constipation happens infrequently, maybe a couple days at a time. Most people associate this with travel because when we travel, we change our circadian rhythms. Our gut has a circadian rhythm. It can be associated with changes in the microbiome based on our diet. And there are probably other physiologic and external environmental factors that play a role. But these are people that are normally day in, day out. I get up in the morning, I have a bowel movement or two. I feel fine. I feel like I got everything out and I move on with my day in life and don't worry about it. As opposed to people with chronic constipation, where they've had this for months, years, decades for some of my patients. And it's really broken down into a symptom-based profile. And some of these symptoms are subjective and some of them are objective. So we have found in the United States that the average person, I know this sounds extreme, but the average person should have anywhere between 3 and 21 bowel movements a week. So that is a wide range for 95% of the population. So the first thing we look at is frequency. Then we look at texture. The texture should look like something like a bratwurst or a sausage, maybe some ridges. I compare it to a Snickers bar, soft pieces. But it shouldn't be hard and chunky. So ladies and gentlemen, I know this is gross and I apologize. And we're getting close to Easter now, but if your bowel movements look like Milk Duds or Baby Ruth bars, there's something wrong. Go talk to your practitioner, okay? Those are two of the three objectives. The third one nobody ever wants to talk about, which is physiologically manipulating the pelvic floor, i.e. manual disimpaction. You stick your finger in your bottom to try and pick stool out. Or for women, we call it splinting. If you do this, please mention it to your practitioners. You put a finger or two in the vagina, you push down to help you go to the bathroom as well. Then there are three subjective symptoms. How much do I strain? Do I feel like I get everything out? And do I feel like there's a sensation of a blockage? Like, is there just stool down there? I know it's down there. I'm pushing as hard as I can. I'm about to pass out and I can't get it out. So all of these are the different factors that make up constipation. And I think it's important to be aware of these because most people just think about constipation as frequency and texture, but it's so much more than that. And we have to be aware of that piece. One final thought, because I know we talked about oh my gogs in a previous episode, which was the secretagogues for IBS-C. The way historically practitioners have differentiated is constipation, no pain, irritable bowel syndrome with constipation, pain. This couldn't be farther from the truth. People with constipation can have pain with their symptoms. So there may be some blurring of the lines between these two disorders.
Well, first of all, I'm never going to be able to look at a Snickers bar the same again. Thank you, Dr. Brenner.
My pleasure. Got to get some fun out of this, right?
Absolutely. So before we jump into the traditional treatments, can you explain the role that gut motility plays in this condition, and how does it impact patients that have chronic idiopathic constipation?
it's really important. It comes down to, water in the GI tract. So obviously, if you're constipated, we want to add more water, and that can be done with bulking agents like fiber, stimulant, osmotic laxatives, prescription medications. And what that's basically doing is adding something liquid to something hard to make it soft. So that's a portion of this. So that's going to be an issue. But also, most importantly, we're looking at motility. There are multiple studies that have shown that the slower things go through the GI tract, the harder they come out the other end, and vice versa. The faster, the softer. So we always think about it, and we should think about it as stool texture correlates with transit. It's not stool frequency. I have people that have 15, 20, 25 bowel movements a day, and they think they're having diarrhea and they're having constipation because they're only passing, as we were mentioning earlier, a milk dud at a time. So if you've got a rectum that this stretched out with stool and it wants to be here, and you pass a pellet and a second pellet and an eighth pellet and a 10th pellet and a 25th pellet, it takes a long time to get there. So a major portion of this is transit, and it's a key component of what we're looking for and what we're trying to do when we treat people with chronic constipation is to affect or impact that transit.
Now, traditionally, what are some of the treatments? And I know you've so generously addressed this in previous episodes, but for those who may be jumping in at this episode, why do traditional treatments, first of all, what are they? And why do they fall short for many patients?
Yeah, so traditional treatments, we can start with just diet. People always look at what food should I take away to help my constipation. And the reality of the situation is we have not, from a population-based standpoint, ever defined a specific class of foods to take away to help with constipation. But we have identified soluble-based fiber foods that have been shown to be very effective, like kiwis. 2 peeled green kiwis a day can be effective. 6 to 9 prunes, slices of mango, chia flax seeds, oatmeal, all these high fiber, soluble fiber foods that can be very effective just in your diet. We can use soluble fibers like psyllium. As I mentioned earlier, we've got the over-the-counter things like the stimulants, Senna, bisacodyl, osmotics like PEG 3350, Miralax. Most of us recommend stool softeners because they don't affect the mechanism of having a bowel movement. And then you get into a multitude of prescription medications, things like linaclotide, plecanatide, prucalopride. There's a lot of ides in this process. What else am I missing here? Lubiprostone. We'll talk a little bit about the Vibrating Capsule. And then if you're not into taking medications or using mechanical devices, there's data on acupuncture, acupressure, maybe a little bit of abdominal massage. All the data here is a little bit weaker as well. And while we talk about probiotics all the time, there isn't really prime time there. So lots of therapies. So then the question becomes, well, if it's that simple and there are that many things, how come they don't work? And there's 2 reasons. Number one, we don't give these therapeutics enough time to work. I see people all the time. I'm like, have you tried X, Y, and Z? And they say, oh, yeah, I've tried everything. And I say, well, how long did you try those for? 1 to 2 doses. That's not going to work. You have to give these things a couple of weeks, if not a month, to see if they're effective, especially based on rigorous trials. So that's one issue. We don't give them enough time to be effective. Another issue, people develop side effects and can assume that these therapeutics fail. So it's not uncommon on any medication for constipation to develop diarrhea for a couple of days because you may be clearing and purging your system, but things go back to normal. So people should be aware of that as well. And then the other issue is that it's not a one-size-fits-all process. Different mechanisms cause constipation for different individuals, both on the motility side, but also on the pelvic floor side. And I know that's not what we're discussing today, but I will say to our listeners, if you're trying lots of laxatives and they're not working, your issue may not be a movement issue. It may be a muscular issue in the pelvic floor that is treated with physical therapy and biofeedback. So if you've tried 1, 2, 3 laxatives, if you're taking 3 laxatives at a time and it's not working, talk to your primary care practitioner or gastroenterologist about potentially referring you to a specialist to assess the muscles of your pelvic floor.
I'm so glad you mentioned the pelvic floor because we've done episodes on this. You've mentioned it several times. We interviewed pelvic floor therapists as well. And it's unbelievable how many patients have written us and talked about they're so happy to hear that there's this relationship with the pelvic floor because they had no idea. And one more thing, I'm glad you mentioned peeled kiwi fruit. I can't tell you how many people ask us, do they eat the skin on the kiwi fruit?
There's nothing wrong with eating the skin, but in the clinical trials, if you're skin averse, the kiwis were peeled. So it's going to be just as effective, we think.
Yeah, they're kind of fuzzy. I wouldn't think of eating the skin, but hey, it maybe have a lot of fiber. I don't know. But this is great because I love talking to you about these mechanisms of action. And, we wanted to focus this episode on this fairly new drugless treatment, which is it's novel and it's also kind of mysterious. Like people want to know how it works. And, you were recommended as an expert to really get into this with us. We're going to talk about the vibrating capsule, which is wild. And you've actually used it in your practice. So before we get into, the results and how your experiences were with the patients, tell us a little bit about, what inspired the development of this capsule. And I know your area of expertise is motility, so I think you can do a good job with this.
Well, thanks. And I appreciate the kind words. Yeah, the Vibrating Capsule was developed in Israel by a group of specialists who are trying to work on different mechanisms to potentially improve bowel movements, because we all hear from patients all the time, I don't want to take a pill. I don't want to take a laxative. I don't want to be dependent on this. If I start taking it now, it won't work in the future. And if things get worse, I don't want to have to worry about that. And so it really potentially markets to a different segment of the population, not meaning that it can't be effective for everybody. And the capsule is just basically 2 centimeters by 1 centimeter. And you swallow this capsule, usually at night before you go to bed, about 9 or 10 o'clock in the evening. It activates about 10 to 12 hours later, and it gets into your colon, and it basically has a little vibrating trigger on it. So what you do is you put in a little pod. The little pod has an activating mechanism in it. It tells the capsule when to start vibrating. You swallow it. And then when it works, it cycles through about 3 cycles of vibrations a minute for a couple hours, and it just stimulates vibrations in the GI tract. A pretty fascinating technology that really people hadn't thought about previously, that has been shown both anecdotally and clinical trials to be very effective for improving bowel movements in patients with chronic constipation.
Yeah, it's and it makes sense because if the colon isn't working, it makes sense. It's like if it's even when you have like a muscle and you're an athlete and you got to get those muscles, don't they do those kind of stimulation things?
Yeah, and it's very similar. I mean, what we think is going on is, the body has its own, bowel, I should say, has its own circadian rhythms. And really, our bodies are primed to go to the bathroom 4 times a day. First thing in the morning when we get up, which is why for a lot of people, a cup of coffee or something helps, or their oatmeal as well. And then after meals. So a lot of patients come in with constipation. They say, I just can't eat anything. I feel miserable. And I beg them, I'm like, please, please eat something, because this is the mechanism. And what's happening is you're stimulating what we call HAP-Cs, or high amplitude propagative contractions. You make the colon push more vigorously and more aggressively to push the stool around the large intestine. And we believe that what the vibrating capsule is doing is it's kind of mimicking that effect. And it does seem to alter circadian rhythms, because, as you said, we're going to talk about in clinical trials, people seem to go to the bathroom more frequently while the capsule was vibrating actively, or in the few hours after it was done vibrating. So some interesting, fascinating ways of working.
Yeah, it makes sense. So how do the mechanical vibrations, how do they stimulate the gut motility?
The vibrations are probably just going to the GI tract muscle and asking it to stimulate, asking it to peristalse more than it does normally.
Wow. That's so cool. Now does the vibrant capsule, does it impact the microbiome or any gut secretions or anything like that?
It's a great question. I don't think we have the answers to those questions. From a biological plausibility standpoint, I don't think that it would affect the gut
Yeah.
microbiome at all. So I don't think it's dangerous in the least bit. As a matter of fact, I think it's one of the safest therapeutics out on the market for treating chronic constipation.
I always have to ask the out there questions. I
Yes,
threw one in there for you,
absolutely fine. I love to hear it.
So I know you're doing some research in this area. So can you give us a sneak peek on some of the early or the initial clinical trial data, and then what's coming down the pipeline in terms of effectiveness and safety?
So I shouldn't say we, but a group of my colleagues did the original seminal paper that, for people who are interested in it, was Dr. Satish Rao, who was the first author in gastroenterology, and I believe it's open access. So anybody who wants to look this up can read it. What they did is they took these capsules and they gave people capsules to be taken at night 5 days a week: Monday, Tuesday, Thursday, Friday, Saturday. On Wednesday and Sunday, they rested. And they allowed these capsules to vibrate. So they got the vibrating capsule or a sham capsule. And they took these again 5 days a week for 8 weeks. And the primary endpoints were increases of at least 1 complete or 2 complete spontaneous bowel movements a week. Now, what's the difference between a spontaneous and a complete spontaneous bowel movement? Both people have a bowel movement, potentially because of the capsule, but complete means you feel that you got everything out. It's a much more rigorous endpoint. When people come to us and they endorse constipation, we treat it. I think the hardest thing to treat is that sensation of incomplete evacuation. And that's what the complete spontaneous bowel movement is looking at, getting rid of that sensation. And at the end of 8 weeks, there were significant increases in the number of complete spontaneous bowel movements that people experienced with the vibrating capsule compared to placebo. And the adverse event rates were very low. As a matter of fact, the most common adverse event, if you want to call it an adverse event, is that some people felt like the capsule was vibrating in their GI tract, probably because, it was vibrating in their GI tract, which is okay. More recently, a group of us have published a retrospective analysis of 6 trials looking at the safety of this therapeutic. And the adverse event profile is really low. If I remember correctly, I think bloating was the most common, at less than 3%.
Oh, wow.
And we are now going to present some data at Digestive Disease Week here in 2025, looking at the long-term efficacy and safety out to 3 to 6 months. And we see the same thing. People who are taking this capsule are continuing to maintain their response with respect to complete spontaneous bowel movements, other symptom-based profiles, but importantly, the safety component is excellent. And one thing we like to talk about specifically with this therapy is diarrhea. One of the downsides to all the laxatives, as I mentioned earlier, it can be early, but it can be maintained over time, is diarrhea, with some of the drugs causing diarrhea in the ranges of 15 to 20%. With this capsule, across the spectrum of all the data we have and out to 6 months, the rates of diarrhea are really less than about 2%.
Oh, wow. That's great news for patients who, worry about that.
Right. So this is one way that some of my patients decide that they want to use this as a first-line agent. They say, look, Darren, I've seen people before you. I've taken over the counters. They all make me poop. They all give me urgency. I don't want to be somewhere where there's no bathroom. What else can you do for me? And this is an option where I can say the likelihood of developing diarrhea from this is very, very low.
I think that's really important point, because it is a fear of patient. And at the end of the day, it impacts the quality of life. Imagine, patients live in fear that they're going to have an incident at work, on the road, traveling, and they'd stop doing things because of this.
And that's the key, right? It's not so much, I have people 3 bowel movements a week, 4 bowel movements a week. That doesn't matter. The question is, can I get on a plane and go to Europe and worry about the fact that I'm going to be in the bathroom for 3 hours and then, the flight attendant's going to knock on the door and make sure I'm okay? Or can I go to a wedding? Can I go out with my friends for dinner? Those are the things that are really important to patients. Those are the things that we as practitioners have to target. And I think key in on more than we have in the past, where we focus on those criteria we talked about to begin this conversation. Yes, those criteria are important, but really at the end of the day, it's all about how is this impacting you in terms of what you can do, how this impacts your quality of life, and what are you able to do after therapy as opposed to before.
No, I'm so glad we talked about this. Now, the other thing that kind of goes hand in hand with this, and I think you're exploring this, and I think that in the studies, is patient adherence. I know that there's a companion app to this, and, a treatment is only as good as, you mentioned this at the beginning, you have to continuously give it some time and also be able to follow the instructions that your doctor gives you. So how does that look in your patient experience?
I think it's important, and we've also published some literature on this, looking at adherence to the app. And it appears that adherence increases compliance and improves outcomes. So I think it's a nice way of having people just keep track of their symptoms, because historically what we found is that recall of bowel symptoms is very, very poor. What people think is going on, retrospectively when we ask them, and what's really going on prospectively when we ask them to check the boxes and monitor it, are two completely different things. So what the app does is it provides people with a snapshot of what's going on in real time. People can say, oh yeah, I am having regular bowel movements, much more so than I was before. This probably is having an effect on my my chronic constipation. And I think not only in constipation, but everything, this is important, because people come in all the time and they say, I started this a month, 2 months, 6 months, a year ago. Do you think I should keep taking it? And my response to that question every time is, well, do you think it's helping? And in more than 50% of cases, patients' responses are, I don't know. And then my response is, well, then stop it and see if anything changes. But when you've been taking something for a long time, you kind of become complacent, right? I have people who've been taking acid blockers for years. They don't know if they need them. They were just started on them at one point. They don't even know if they're effective. So I think being able to monitor and track over time can be very, very beneficial and effective for patients.
That's amazing. So let's talk about your experience with your patients. Like, give us some insights on what has been the patient response to this, and any memorable patient success stories that you want to share to give our inspiration to our listeners here.
Yeah, I think that this particular device and technology can be used for anybody. It could be primary therapy, it could be tertiary or quaternary therapy. And I'll say honestly, since the vast majority of the patients that I see are referrals, I'm using it more as a third or fourth line intervention. Not that I couldn't use it first, it's just that people are coming in and they've tried and failed everything.
Yeah.
And I've actually seen some decent success in this population. And I will be totally honest with you. I was, what's the word I'm looking for now? I was a little bit hesitant. That's not the right word.
Or just skeptical because it's a novel thing.
That's exactly what it is. I'm skeptical. I'm like, we're going to vibrate the colon. These people have failed lots of other things before, and they got pelvic floor problems. How's it going to work? I've been quite surprised. I've had people who have come in, and this is their last line of defense, and it's been a game changer. I've had many people that have now used it, 8, 9, 10 months in a row and are doing just fine on this alone. And I've had some people who have mixed it with laxatives. That's okay. Use 2 different mechanisms of action. It's fine. What I will say, however, is that I've really had nobody stop it because of a side effect. Now, a couple of caveats. If people have motility issues in the upper GI tract, a disorder we call gastroparesis or pseudo-obstruction, chronic intestinal pseudo-obstruction, where they have slower upper GI motility, it's contraindicated. If you're going to use it in patients who need an MRI, we do not know if it's MRI safe. These patients must have x-rays and make sure they've cleared these capsules of their gut before they go into the MRI scanner. So just a couple of things that are caveats to be wary of. But other than that, I have little to no concern in the patient population. You can pretty much use this in anybody. And again, when I've offered this to my patients, and they're like, wait, I can take something that isn't a laxative or a medication and I won't have to be, and I say, yeah, that is a game changer for some of my patients.
So there's a lot of people on those GLP-1 drugs for weight loss. And we've heard numerous stories and reports that it causes motility issues and subsequent sometimes can cause constipation. Would you recommend this capsule for those patients?
I will be honest, I don't have any literature to make the suggestion, but I'm weary because of the delayed motility effects, especially in the upper GI tract, that the capsule may not be where it needs to be.
Makes
when it starts vibrating.
Okay.
So this would not be my first line intervention for treatment who develops a GLP-1 associated constipation.
So if a patient comes to you with constipation from those GLP-1 drugs, would you treat those patients for constipation, or would you tell them to get off those weight loss drugs?
I think that's a really important question. It really depends on the reason for the drugs, right? If it's an individual that's coming in and is just trying to get some mild weight loss, a couple pounds, 5, 10 pounds, and they're developing constipation and other GI side effects, then I would probably say, you know what, stop the GLP-1. Let's see if we can find another way to do this with diet and exercise. If somebody's coming with diabetes, heart disease, morbid obesity, where these drugs have been shown time and time again, metabolic associated steatotic liver disease. I want to get all the big ones in here. And they're using it for those indications where time and time again, the research is showing that it is improving the outcomes, improvements in hemoglobin A1Cs, weight loss, better heart function, normalization of liver enzymes. Then in those cases, I absolutely will treat the constipation and keep them on the GLP-1As.
So what are your suggestions for patients that are interested and curious about this? And how do you suggest that they access this? Do they need a prescription?
Yep. So it is an FDA-cleared therapeutic. You do need a practitioner to write a prescription for it. So my recommendation would be a couple of things. Number one, go onto the website. Just type in Vibrating Capsule or Vibrating Capsule into your Google, and it'll come up right at the top. And take a look at the information, the literature, and then discuss it with your practitioner. Make sure it's the right option because again, there are a few different contraindications. We want to make sure that you don't get stuck in a dangerous situation.
That's great. Well, this has been as always, so insightful and educating. Is that a word? It's been very educational, informative. Really appreciate your time and thank you so much. Don't forget to like, subscribe, share this episode. Check out our Constipation IBS-C playlist with Dr. Brenner. Has several more episodes on a variety of topics related to constipation and IBS, and they're fantastic. Dr. Brenner, thank you as always. It's so great to have you on the show, and we appreciate your time.
Thanks again for having me. I love doing it.
Thank you for listening to the Gastro Girl podcast. For more information and resources, please visit gastrogirl.com. Do you have a question for Gastro Girl? Please email podcast@gastrogirl.com. The information, opinions, and recommendations presented in the Gastro Girl podcast are not a substitute for medical advice from your healthcare professional. Please consult a licensed clinician in your state regarding all matters related to your health.